I feel you. Okay, we're gonna get started. Are there any final questions before we open it up to our participants? Thank you both so much. Okay, and we're broadcasting. Welcome everybody to Friday, because it's Friday. I'm gonna introduce the two folks helping guide our conversation today, and then I'm gonna stop talking. First, we have Amy Mueller, who we all know and love. Amy is the former artistic director of Playwrights Foundation and now is just an incredible, is an incredible leader in our community. And she's gonna be speaking about some of the knowledge she has and share it with us. One thing I want to say NEERA GUNN is that neither NEERA nor Amy are employees of the EDD or employees of the state or experts. And she is going to be watching the chat and helping answer questions as we go. In any sense, these webinars are designed to help us all kind of navigate this together. But if specific questions start to come up that are kind of beyond the scope of this conversation, both Amy and NEERA will be encouraging people to reach out to those experts at the EDD. So I'm going to stop talking now and hand it off to the very wonderful Amy Mueller. Amy.
Thank you, Leanne. That's very nice. Hi, everybody. Oh, my Lord. Here we are from home dealing with all this. So I hope you're doing well. I hope everybody is taking some time to not be productive and just be. And I know we're all kind of struggling to try to figure out these systems that are really new. So I've been listening to a couple of town halls here in Oakland and then did a bunch of research based on that. So I think I have a kind of overview of the CARES Act. Not detailed. Again, Leanne said that we're all lay people in that regard. And we also want to really encourage everyone to understand that the entire country and indeed our community here and in the arts sector, we're all in this together, and that sometimes there's this weird stigma about applying for unemployment or getting, help when you need it. And we want to encourage you to go ahead and apply for unemployment insurance. Get yourself in the queue. Over 10 million people have current applications in, and the EDD will help you through this. Based on the situation that you are in. So what I'd like to do is just start with an overview of the different kinds of benefits that are currently available as of April 2nd. That being said, I just want to let you know that there are two really great websites, and I want to put that out front and center. Sorry about that. The first one is called Legal Aid at Work, and it's basically legalaidatwork.org. And the second one is the National Employment Law Project, and that's NELP.org. Stop. Got the mail. Those are two excellent resources that have a lot of information in detail on their websites and are up to date and current. And at the end of this, I'll also give you a phone number you can call to get your own private phone call back and consultation free. So types of unemployment insurance you can apply for. There's the regular unemployment insurance, UI, for regular salaried employees qualified with about a year of wages, independent contractors or gig workers who were misclassified, or if you believe you've been misclassified, or worked as an employee before becoming self-employed. So if you're currently self-employed or just recently self-employed, but you were previously employed as an employee, you still will qualify for regular benefits. People are really encouraging independent contractors who have documentation in the form of, you know, just really all you need is the information about your employer, basic information. Not any, you know, numbers or anything, just basic information and how much you were paid. They're encouraging independent contractors or gig workers to go ahead and apply for unemployment benefits as if you've been misclassified. Unless you really, you know, you're self-employed and you've paid taxes as a self-employed individual for a long time, then perhaps you're not misclassified, or if you have a business in the arts or other sectors. But they're really encouraging you to go ahead and apply for regular employment. It's you get between $50 and $450 a week, depending on how much you earned in this last 18 months. And it's 26 weeks of employment. That's your regular. In addition to that, there's something now called PUC, which is Pandemic Unemployment Insurance Compensation. And that is in addition to your benefits. You will also receive $600 per week. It is automatically applied to your unemployment insurance. And it will give you an additional 13 weeks of unemployment. You can also apply for the pandemic unemployment compensation if you've exhausted your 26 weeks of unemployment up to this point. So if you've been on unemployment and you've exhausted your unemployment, you can apply for PUC. There's a third one is called Pandemic Emergency Compensation. That's PUA. And that provides emergency unemployment assistance to workers who are left out of the regular state unemployment insurance or who have exhausted their state benefits. You can get up to 39 weeks, which is the amount. And the people who PUA eligibility includes self-employed workers and independent contractors, freelancers, workers seeking part-time work, and workers who do not have a long enough work history to qualify for state unemployment benefits. So if you haven't worked for the last year, for example, or the last 18 months, and you can't normally qualify for unemployment benefits, you can through the PUA, which stands for Pandemic Unemployment Assistance. The things that you need to provide are the person's name, phone, address, and physical location, the company name, the type of work performed, the dates that you worked, and how you were paid. And that means either hourly, weekly, or by contract. You don't have to say whether you got a check or any, not that how. The how is hourly, weekly, or by contract. Okay. The other thing that I wanted to say is that regular unemployment insurance also applies to people who were employed full-time and have been reduced to part-time. I'm going to say that again. If you are currently working part-time, but you were reduced because of the COVID-19 pandemic, you can apply for unemployment insurance. And I believe that you will, I'm not sure, but I believe you will get the $600 a week for sure. And then if you make less than $450 a week, they will make up the difference for the regular insurance. So there's two chunks of money. One is a regular unemployment insurance between $50 and $450 a week. And then in addition to that is the $600 pandemic insurance. So if you have been reduced to part-time, you can apply for unemployment insurance. The other types of benefits that are available for those who are currently employed or who have been employed within the last 3 months, and apparently it is also retroactive. And that was from the lawyer that I heard speak from Legal Aid at Work. she said that it is retroactive to, I have to look at the date, sorry. That's paid sick days. And the state of California has a law. Your local jurisdiction will have a law. And then in addition to that, the CARES Act provides 2 weeks of paid sick leave in addition to what you would normally get. That is paid out through your employer, and it is a state law. Or you can get state disability insurance. That is if you are sick yourself, or if you have someone who becomes sick and you need to care for them. There are different amounts that you can get, and we don't need to get into those details right now. And then finally, there is paid family leave. Paid family leave is through your employer, again. There's a certain length of time you can get. I don't have that right in front of me at this moment, and but it's significant. And that is for people who are currently working but need to take time off to care for children or to care for someone who is sick. And depending on your circumstances, they would recommend either the state disability or the paid family leave. And that's something you would need to get clarity on. I'm going to give you a phone number. If you need help for your specific circumstance, you can call Legal Aid at Work at 415-404-9093. And you can make, I think that's the most recent number I got. And you can leave a message and make an appointment, and someone will call you back, and you can get an appointment with a lawyer for free. Okay. I was going to go ahead and answer some of the questions that came through, unless there are any burning questions about what I just went over. Okay. So the first question we got on the form was, as someone whose full-time job got cut to part-time, am I able to access any support for the hours lost due to COVID-19? The answer is yes. The amount, I actually don't know. That's something you just go ahead and apply for unemployment insurance, and that they will assess your situation. My hours were reduced to part-time, but I anticipate that I will be furloughed in the coming months. Would it be possible to apply for unemployment insurance at one rate and then change the rate to a higher one further down the line? I am not sure about the answer to that question, but my gut instinct, having read through a lot of everything and also having gone through the process myself, is yes, you can change it. I submitted a claim on March 28th listing only my W-2 income. Should I wait for the EDD to approve the claim I filed before adding my 1099 income, or should I revise the claim I submitted last week? And they base your rate on on the highest quarter in the last 18 months. So whatever the highest quarter of earnings are in the last 18 months, they will base your rate, your unemployment benefits on that amount. I know that in the past, the amount of UI weekly benefits was based on one's past 18 months of employment. I also have seen the template letter that Eric posted on Facebook, providing artists, that's Eric Ting from Cal Shakes, for those of you who don't know that, providing artists that were scheduled to work in the Cal Shakes 2020 season with a sort of proof of employment in lieu of a contract, and specifying what their contracted dates and wages were to have been. How are we meant to use this proof of future employment, now canceled, since it's in the future and not in the past 18 months? Very good question. I will say that I believe, based on everything that I've read, that it's a current situation. In other words, if you are currently laid off or have lost a contract for employment, you can provide that for the EDD and let them figure it out. What they base your rate on is what you made in the last 18 months. That's what they're going to base your rate on. So if in the last 18 months you were fully employed, they will take the 1 quarter of those, the highest quarter, earnings quarter of the last 18 months, and that's what your weekly rate will be based upon. You will also additionally get the $600 a week. And as far as the current contract that has been canceled, I think that that is proof that you are no longer employed. Does that make sense? So if you're working on contract and the EDD asks you for proof that you are no longer employed, you would use that letter. I'm gonna say that's what I think, being a layperson. I'm self-employed and lost all income due to COVID-19. How do I apply for unemployment? So that is a very good question. You have 2 choices. One choice is to go ahead and make your application, and when you can just tell them how much you made, and you can say that you were mischaracterized as misclassified. I'm sorry, I used the wrong word. Misclassified as a 1099 employee instead of a regular employee. That's one option, and you can do that now. The other option is to apply as a 1099 independent contractor, and that aspect of the EDD's application process is not yet available, okay? I learned that last night, again, from Legal Aid at Work. However, she said they're working feverishly on the application and that you should just keep returning to the site, and you can go ahead and get an account. And she said that it's going to be available soon, but it's not yet available. I received funding through an emergency grant. Does that count as income when I certify my week? Yes, it does. However, it's counted as other income. So you can say it's not necessarily, if you didn't work, you looked for work and you were not paid for any work because you weren't paid, that's a grant. Then you just answer all those questions, and then later it says, did you get any other money? And they have a whole list of other money, and that's where that you would record that. And I don't know whether or not that would impact, but I would just report it for the week you got it. Don't spread it out over several weeks. It's for the week you got it. Can I apply for unemployment if my hours have been cut from 60 to 40? I don't know. I doubt it, but you know, it's worth a try. If you're paid, if you're an hourly employee, probably not. If you're not an hourly employee, do the hours really count? Or can you just say you've been cut back? Just a question. How does applying for work if you still have a job but have reduced earnings? How, okay. I see what you're saying. In other words, is there a look for work requirement? And how do you calculate your benefits? The EDD actually does that, and it's probably really complicated. Yeah, I work with Playwrights. Numbers are not my my thing. The other, I will say that if you have a small, if you're a business person, either in the arts or another sector, if you happen to be on the call, there's a whole nother layer of benefits for businesses. There's a local level of benefits, there's a state level of benefits, and then with the CARES Act, there's a bunch of benefits that you can access. And I do have a little bit of information if anybody has a question about that. And the unemployment benefits and paid sick leave or expanded family and medical leave are mutually exclusive. You can't have one and the other. So if you are caring for someone who's sick and you've been laid off, you have to make a choice about which benefit you're going to seek. I've heard from the legal aid at work that the family benefit and or disability money is a much longer and more, you get a lot more money. It's like 2/3 of your regular paycheck. So they recommend that you go with that instead, if you're able to, instead of unemployment.
NEERA, did you want to go through that slide a little bit before we jump into questions? Yeah, sure. Because I think a lot of questions that are coming in, is very confused. People are still very confused in terms of the CARES Act versus the FFCRA, the Families First Act, versus UI, which is unemployment through the state of California. There's just so many options for everyone. So if you could pull up that second slide in that PowerPoint, I can briefly go through some of those questions. These are the frequently asked questions that we are seeing in terms of popularity all across the board. And I do want to say that, I know it seems like there's a lot of 1099 and gig economy workers on this phone call, and some of this is more geared towards actual employees of a company. So I just wanted to make that disclaimer. So in terms of 1099 independent contractors, I'm not exactly sure yet the answers to those questions, but I'll quickly go through the answers to these questions. And I know Leanne will be also following up with a pretty intensive PDF with more information, but at a high level format, I'm going to go ahead and answer these questions for you. So question number 1, how does the coronavirus aid, relief, and economic stability, which is the CARES Act, help me, right? So this provision applies for the period between January 27th through December 31st, 2020 to individuals who cannot work or telework, work from home, that are not receiving paid sick or other paid leave benefits and who are not eligible for regular compensation or extended benefits under state or federal law or pandemic emergency unemployment compensation. Now, the CARES Act is a federal act. It's not UI, it's not EDD. UI is unemployment insurance. Most people are applying through UI through the state right now through EDD. CARES is through the federal government right now. So the folks that are eligible are people who can provide self-certification for the criteria that they will need to work directly with their employer to apply for the benefits. So basically, people who are eligible are folks who are otherwise able to work and available for work within the meaning of the applicable state law, except that the individual is unemployed or partially unemployed or unable or unavailable to work because of one of the reasons. And there's 9 different reasons, and I'll just briefly go through them. So you're eligible for CARES if you or a member of somebody in your household has been diagnosed with COVID-19 or is experiencing symptoms with COVID-19 and seeking a medical diagnosis. 2, an individual who is providing care for a family member or a member of the individual's household who has been diagnosed with COVID-19. 3, a child or other person in the household for which individual has primary caregiving responsibility is unable to attend school or another facility that is closed because of COVID-19. So these are all the folks who are mommy, daddy, or caregivers that are now home homeschooling their children because their daycares and their schools have closed. So that those folks are eligible for this CARES Federal Act. 4, an individual who is unable to reach the place of employment because of a quarantine imposed as a direct result of COVID-19. Now, for the federal government, for CARES, quarantine is not shelter in place. Quarantine is for somebody who absolutely, by doctor's orders or airport, or has been traveling, as you know, somebody has told them and has actually given them directions to be quarantined. So that does not apply. CARES does not apply to shelter in place. Okay. Number 5, the individual was scheduled to commence employment and does not have a job or unable to reach the job as a direct result of COVID-19 public health emergency. 6, the individual has become the breadwinner or a major support for a household because the head of household has died as a direct result of COVID-19. 7, the individual has to quit his or her job as a direct result of COVID-19. 8, the individual's place of employment is closed as a direct result of COVID-19 public health emergency. Or 9, the individual meets any additional criteria established by the Secretary for Unemployment Assistance under this CARES Act. So, that some things to take note are the folks that are eligible for the CARES Act, people who are self-employed, seeking part-time employment, do not have sufficient work history, or otherwise would not qualify for regular unemployment through the state. Also take note that this is a limited duration. It's only available for a maximum of 39 weeks, including any week for which the individual received regular compensation or extended benefits under the federal or state law. And this has to start after March 27th, 2020. The amount of assistance that people can get under the CARES Act is still kind of hazy in terms of how much people can get, but there is a link in the handouts that you can look into that can probably give you more information of where you lie within the weekly amounts and the benefit amounts. So people, you probably heard this in the news. So for the tax year beginning in 2020, eligible individuals will, folks are eligible for this, for the CARES Act. And basically the CARES Act is that stimulus package, right, that we've all been waiting to hear from. So, anybody who earned up to $75,000 per taxpayer in the household, you get $1,200 for each adult. Plus, if you have children at home, you get $500 for each child, right? So basically it's either, $75,000 per taxpayer, or for a joint household, it would be $150. So it'd be, two incomes going up to $75,000, which would grant you $1,200 per adult in that household, right? But with the household being 150 max is the cap, right? So that means 2 people who are married and filing jointly. 2, if the incomes over these thresholds are reduced by 5%, creating prorated refunds to those whose incomes between $75,000 and $99,000 per taxpayer. So basically, if you received between $75,000 and $99,000 in annual income earnings, you will get a reduced amount. So you will not get that $1,200. It would be reduced by 5% depending on how much you earned. So basically, these checks are being mailed out right now in terms of the stimulus package. and you should be receiving something in the mail within the next few weeks or so, based on what the Treasury Secretary for the US has said. And depending on how you filed your taxes last year, so if you did direct deposit, then those monies will go straight into your direct deposit account. If you did a manual, got a live check in the mail, then you can anticipate getting a live check in the mail. But I do believe that if you got a live check in the mail, then it will take a little bit longer. So that is what we know about the CARES Act so far. Another popular question is, how does the Families First Coronavirus Response Act help me? So this is another act, totally different from the CARES Act. So eligible employees are all employees who are covered by the employers who are eligible for 2 weeks of paid sick time for specific reasons related to the COVID-19. Employees who are employed for at least 30 days are eligible for up to additional 10 weeks of paid family leave for health care, for care for a child under circumstances related to COVID-19. So anything that's related to COVID-19 would be a qualifying reason for leave. So that would be, so for the Families First Act, which is different from the CARES Act, we have an employee who would qualify for paid sick time if the employee is unable to work or unable to work from home due to a need for a leave because the employee is subject to federal, state, or local quarantine isolation. So remember, quarantine is not shelter in place, right? So that's a little bit different. 2, have been advised by a healthcare provider to self-quarantine related to COVID-19. So basically, your doctor saying you've gone to the doctor and they're telling you to self-quarantine. Number 3, experiencing any kind of COVID-19 symptoms and seeking medical diagnosis. 4, caring for an individual subject to an order described in the self-quarantine. 5 is caring for a child whose school or place of care is closed or child care provider is unavailable for reasons related to COVID-19. 6 is experiencing any other substantially similar conditions specified by the Secretary of Health of Human Services. So, people are pretty much asking like, okay, well, this is me. I have to take care of my husband. He's got diagnosed with coronavirus. So how do I apply for FFCRA for this act? How do I do that? Well, that is through your employer. So your employer will actually be paying you for this, and then your employer will be reimbursed by the federal government after. So this check would actually be paid through the Families First Coronavirus Response Act, through the FFCRA. So that is something I do want to call out. So for those of you who are familiar with the FMLA, Family Medical Leave Act, this is an amended act to the FMLA Act. Moving on to question 3, what supplemental income benefits do I have via the state of California? So this is a lot of the common questions that we're getting from a lot of folks. This, when you say UI, you're going straight to the EDD. EDD is the Employment Development Department through the state of California. Right now, EDD is so inundated with the pandemic unemployment assistance program. We've got all different types of workers who are calling in right now. So the best way to to get yourself registered for your unemployment claim is to just go online, and we will be sending, or Leanne will be sending you more information on how to do that. It's part of the PDF that we'll be sending to everybody after this session. So just make sure that you go to how to set up a UI online account. And there's also a link in there to help you navigate how to complete the application or call resources through the EDD to get a phone appointment with an EDD representative. And so there's also a helpful link there. And then there's also 2 different links that will take you to either file a disability claim or a paid family leave claim or an unemployment insurance benefits claim as well. So all of that will be in the PDF that we'll be sending you. Please be patient with the EDD. You have to remember that the EDD is also a business with the state. They are also shelter in place. They are highly, like just understaffed and resourced right now, and they're also working from home. Their offices are closed, so just be patient with the process, and just know that, any kind of specific technical questions that you have in regards to your claim or the process between you and the EDD is going to be an answer best, the answer is going to be with the EDD folks, because we don't know how this works. This is between you and the state. Question 4, my child's school is closed due to COVID-19 reasons. What benefits are available to me? So, again, a lot of people are wondering about this, because I don't know if you've heard, but in the state of California, public schools will be closed until fall. So that means no summer programs or anything like that will be open as well. So, all of you parents out there, you're probably wondering, how am I going to make this happen for the next few months? So if you're unable to perform teleworking, so if there's no work from home options for you, and because your childcare is closed, you can take paid sick leave or expanded family and medical leave intermittently while working from home through FFCRA. So, talk to your employer, talk to your HR department, see, if there's different ways you can figure out how to use the FFCRA intermittently while you're also working from home. So maybe you can have 2 ways of income. You can take intermittent leave in any increment, provided that you and your employer agree. So for example, if you agree on a 90-minute increment, you could work from home from about 1 to 2:30 p.m., take your family leave from 2:30 to 4 p.m., and then return to teleworking. So you can be flexible, and the Department of Labor is very much encouraging employers to be flexible and to collaborate with their employees, so they can figure out a way to make things work during this time. You can take expanded family medical leave intermittently while the school or place of care is closed, if you're not working from home, but that's only with your employer's permission. So intermittent expanded family and medical leave should be permitted only when you and your employer agree upon a schedule. So talk to your head of your organization, talk to your boss, and see if there's something that you can figure out, if, you're healthy, but the only thing that's really preventing you from coming to work is that you've got your kids at home. So see if there is something you can work out. And then let me see, I know we're running short on time. We've got one more question. So can I collect unemployment benefits for the time in which I receive pay for paid sick leave and or expanded family and medical leave? The answer to that is no. If your employer provides you paid sick leave or expanded family and medical leave, you are not eligible for unemployment insurance. However, each state has their own unique set of rules, and California definitely has their own unique rules, but you should definitely check with EDD. But typically, you can't combine all of these, cares with FFCRA, with EDD all together at the same time. Usually it's rolled out in different stages and chunks of time. So that being said, I know we've got about 15 minutes left, and I'll take it back to you, Leanne, and see if there's anything else you want to add or any questions that might come up that somebody on the panel can answer.
Awesome. Thank you so much, NEERA. Like NEERA was referencing, a lot of this will be shared out by email following this call today. So it's a lot of detail, a lot of numbers,
So don't freak out. You're going to have this in a hard copy to spend some more time with. But I think what we're going to do with our last 13 minutes is answer some questions.
Can you hear me?
Yes, go for it.
Amazing. I just wanted to check in on for when you're certifying benefits, if you receive a check for work that was done like several months ago, do you need to list that the week that you get the check? For the do you need to list it for that week for when you're certifying benefits, or would that have counted for the time when you did the work?
This is Amy. I believe you do not need, if it's reported as income from the previous period already, then I do not believe you need to report it while you're on unemployment benefits. That is a question you can ask when they do your interview, because they do phone interviews to get unemployment after you've applied. And you can ask that question. But I believe if you've reported it as income earned, you do not need to report it as income like in your bank account that day.
Okay, great. It was, I mean, for at least in my circumstance, it was not, I did not report it as earned, but only because they only let me list up to 8 previous employers for the last 18 months, and I have worked for more than 8 employers. So that was not listed in that amount.
They have a question that is, did you work this week? And then another question that is, did you receive payment for work whether you worked this week or not? So I think, again, when they interview you, you should ask to say that you have some outstanding checks that have not yet paid for work that was completed, and that for jobs that are now over. And do you report it, or how do you report it? Because basically it's really a week-to-week thing. So when you're on unemployment, you get a questionnaire for each week every 2 weeks. So in the last week, did you work? Did you look for work? Did you earn any money, whether you were paid or not? And so that's where you answer those questions. And I don't even know actually if that particular question even comes up. I'm pretty sure you do not need to report it, because it's for work that you've already done before you were on unemployment.
So this is SK. My question for NEERA and Amy is, for folks who have had hours reduced to part-time and are interested in applying for UI and specifically the CARES funding, would you since it's not being implemented quite yet, would you recommend waiting until that is somehow available, or would you recommend applying now so that we're in the system? And then
yeah, SK, hi, how are you? So here's the thing. I would recommend, because I'm seeing this all across the span of all my clients right now, and everyone's kind of doing their own timeline. One of my clients started the process a couple weeks ago of just notifying their employees that they have a reduced schedule coming on board, and for them to reach out to the EDD and start the process. Because the EDD is so inundated right now, and because they're super lagged, I suggest just registering straight away. So if you know that you have a reduced schedule or have been affected with this COVID-19, go online, register as soon as possible, because there is a delay. Secondly, your employer, and I just found this out, and I'll be working with Sarah, every week there is a form, if you have a reduced schedule, that your employer needs to supply to each individual. It's called a DE something or another form, but I'll be sending this to Sarah. Your employer should be sending you a weekly form with your wages completed, so you can provide that on a weekly basis to EDD to determine your benefits for that week, or for however they determine it. So there is some work on the employer's end that they need to provide to each employee, and then in turn you will take that and take that form and supply that to the EDD, which they will need on a weekly basis if you are a reduced schedule during this time of COVID-19 and shelter in place and all of that with the state of California. Does that help?
Yeah, and just a quick follow-up, would you recommend registering even if at your current part-time rate you may not apply or you may not qualify for funds from the regular unemployment?
What do you mean? Like, can you give me an example?
Yeah, so if you're making $450 a week on your reduced schedule, you wouldn't qualify, right, for
anybody whose employment has been affected due to COVID-19. So whether you've got a reduced schedule, reduced pay, or layoff or closures, company closures, anything that's affected you, you should apply. For example, my tech employees, my tech clients, they're business as usual because they can all remotely work from home and this is not that big of a change for them. So they shouldn't apply because they're still working their normal hours, they're just working from home and their pay hasn't been affected at all. But if anything with your work has been affected due to this COVID-19, you should definitely apply.
I'm going to second that because I believe what I heard last night from Legal Aid at Work was that it will not be a second application with the federal government for the CARES Act or the other act, that especially with the unemployment insurance, that $600 extra per week is going to be tied to your state disability unemployment insurance. The same is true for the state disability insurance and the Family Leave Act. You have to apply through the EDD in your state, and that it's not in place yet because they're not 100% sure how this money is going to come, whether it's going to come through the state to you or whether it's going to be a separate check from the federal government or separate, but people who are cut back to half time will be eligible for those funds as well, I believe.
Thank you all. I think that's about it for the time we have for questions. As I've said before, I'm going to be following up with an email with a lot of these resources that have been named both in this call and the last one, and we'll also be following up with recordings from these meetings. Before we close it out, Amy or NEERA, is there any sort of general wrap up or something you want to leave folks with as they head out to the rest of their afternoon? Yeah, sure. Hey, I know this is a really uncertain time for everybody. So if you have any questions at all, I do believe that the PDF that Leanne will be circulating is going to answer the bulk of your questions that you have right now. We also have to understand that there aren't a lot of answers right now that we want. So for example, that Amy was just touching base on in terms of how does this pandemic, unemployment affect us and how do we get our checks? Is it through the state? Is it through the federal government? Everyone's trying to figure it out. So just be patient. If you have any questions, go straight to your HR department, ask your company. We're all trying to figure it out together. So there are services that are available to everyone at this point. And if you are paying taxes, you will, most likely get depending on how much you earned last year, will be receiving some kind of stimulus check per household. But everything else is just kind of up in the air, and, just be patient and just know that each day we are figuring it out. We're figuring it out and we're waiting for the answers from the federal government, but their answers are still very murky, and the state's figuring it out, the federal government's figuring out, and I know that leaves us, the people, really confused and uncertain. So if you have any questions, go straight to your HR department, go straight to your company, go straight to, Leanne or Eric and see if there's a way we can find the answer for you. But I just want to let you know that we are all in it together, and we're all trying to figure it out together as well. And I hope today's session leaves you with a little bit more of a good place in terms of what you have available for you and your family. And happy Friday.
Happy Friday, everybody.
Thanks, NEERA. Thanks, Amy. So much gratitude to you both for hopping on this call very quickly and sharing this information with all of us. Thank you to you all who have joined us. Lots more to come from me. Sorry in advance for all the emails. And please stay in touch with me, with Cal Shakes, if there's ways that we can support you. One thing we're really focused on right now is trying to be some connective tissue for folks and for artists, especially who are looking for resources right now. So if you can tell us what would be helpful for you to have, we can work hard to get that to you. Great. I'm going to end this call and say happy Friday to everybody. We can be watching the chat and kind of, whacking the moles as they come up. I feel you.